There was no agonizing whether we should do it or not. If I wanted to live, I needed to do it.
2 years ago, Woody Wright made history with a blood cancer breakthrough.
I hope that the success with me can be reproduced.
The UT Southwestern Medical Center professor of cell biology, who has spent decades discovering treatments for cancer and age-related diseases, found himself on the receiving end of science and medicine.
I am the first adult patient to receive this treatment for multiple myeloma.
According to the National Cancer Institute, multiple myeloma is the second fastest growing cancer for men and the third for women.
Multiple myeloma happens when those cells that normally make antibody lose their normal cell regulation and become cancerous and just multiply out of control.
Wright tried 11 different therapies. All eventually failed.
I was basically out of alternatives.
Then he underwent a landmark study in Pennsylvania that has now opened the door for what could be a breakthrough treatment in North Texas.
It's as close to promise for a cure as we could hope for at this point.
UT Southwestern is one of just 9 sites in the country and the only one in North Texas, participating in a clinical trial involving genetic engineering of cells that are critical to human health.
We're very excited to be pioneering this in the region so that it can be FDA approved in the next couple of years.
Here's how CAR T therapy works. A patient's blood is spun to recover the T cells, which are one of the body's mechanisms for boosting immunity and fighting off disease. With CAR T therapy, those T cells are then re-engineered with a gene that targets cancer.
The T cells are grown in culture in the lab and expanded to large numbers, and then they're frozen, they're shipped back to our site. We have the patient receive those in the hospital. They will have an intravenous infusion of those T cells, and they will go into the bloodstream and then go in and attack the cancer.
I am the longest surviving patient to be treated.
His lab is now collaborating with Dr. Larry Anderson to help other patients who don't respond to CAR T therapy.
One possibility why some people don't respond is that their T cells have lost the ability to multiply and divide. We know how to treat cells with an enzyme that is present during normal development but then is downregulated as we grow older. Hopes for the future is that no one ever dies of multiple myeloma again.
Lofty goals this research scientist knows firsthand the importance of reaching.